Hey Pathlight community, today is Monday, May 4th. Ruth Banta here. I hope some of you all were able to get out and enjoy some of the beautiful weather this weekend, whether you were working with our individuals or whether you were home with your families. It was a beautiful spring weekend. Though as of today, we have received no new reports of any members of the Pathlight community testing positive for COVID-19. Now, we do expect that to change as we are going to see more testing. DDS has been providing for testing at our community residences. They have also been providing testing at pop-up sites in Springfield, Greenfield, and other locations for the staff in our community residences. Some of you all may ask why you were not given more notice about testing showing up at our homes. You were given as much notice as we were. So DDS and Fallon have been trying to get things coordinated, and I would say it's not going as smoothly as they would want or we would want. But they are giving staff and individuals the opportunity to be tested. We are still in the surge in Massachusetts, so we expect to hear our numbers increasing as well as some of the statewide numbers. But we're still doing pretty well in Western Massachusetts and not overwhelming our hospitals. And as we start to hear more numbers of people testing positive for COVID-19, people are going to be getting more nervous and anxious. And I want to repeat to you all, when we are notified that someone in the Pathlight community has tested positive for COVID-19, we work very closely with the local public Department of Health, and we follow their guidelines and CDC guidelines about notifying people who within the exposure period and taking all of the proper precautions. So if you have been exposed to someone who's tested positive at COVID-19 in the Pathlight community, we will notify you. So we are still requiring everyone to work really hard to keep our exposure and our numbers down. As I said earlier, we are still in the surge, but you all are doing a really good job. And I know as we're heading into week 8, it's feeling on the one hand like normal, and on the other hand really old. So we are still hanging in there. Keep up the good work. Keep all of those behaviors that one needs to do to keep exposure down, social distancing, working remotely if you can, staying home when you can, not going to work if you are feeling sick, social distancing, wearing cloth face coverings when you cannot social distance or when you are out in public, and of course, washing your hands. Public health folks still say that is the #1 way to prevent the spread, and washing your hands and not touching your face. So thank you all. Keep up the good work. Be strong. Hang in there and wash your hands. Thank you.